Greetings to all my listeners today. Today, I am here as your Dr. Lamo to address some popular misbeliefs and misconceptions and myths about healthcare, about use of medications and some other things that affect how our people take to their health. The first I'll be addressing today has to do with beliefs that antibiotics dry up people's blood. So many of our people believe that they must use blood tonic when they are taking antibiotics. This is wrong. Antibiotics don't dry up your blood, doesn't decrease your blood level, and so it is not necessary for you to take blood tonic with it if your blood level has not been determined to be low. So all this general belief that people have that when they buy antibiotics, when they are prescribed antibiotics, they must take blood tonics, it's fallacy, it is wrong, it's a misconception. For most people using antibiotics without any other medical reason, there is no need to be concerned about using blood tonic. The second common misconception is the belief that antibiotics are too strong for children. Some people believe wrongly that children cannot use antibiotics. It is wrong. Once antibiotics are mainly meant to treat infections, bacterial infections. If a small child, a baby, a toddler has been diagnosed to have bacterial infection and need antibiotics, an appropriate antibiotic should be taken by such a baby. Because babies and children are also adults. They are like a miniature representative of adults. So they should use antibiotics when necessary and when prescribed by a competent doctor. The third misconception I believe is this belief that hospital care worsens cancer. Some people refuse to go to hospital for treatment of their cancers until it become very late. Medically, we know that some cancers are curable or will better be managed when it is diagnosed early and treatment is commenced early. So when somebody is diagnosed with cancer, the best is to seek treatment in the hospital in the hand of competent experts early. A lot of time, early treatment, proper treatment gives better cure, better treatment, and better outcome. So this myths held in some part of the country needs to be discarded. There is this other general belief that when somebody have epilepsy, also known as convulsion, that when you touch such a person, the epilepsy will be transferred to the person touching the person. It's a lie, it's a fallacy. Epilepsy has to do with problem with the cells in the brain functioning abnormally. So, but when somebody is convulsing and you discover there are dangerous things around you that can harm the person, it is wise that you hold the person to prevent unnecessary injuries. The epilepsy will not be transmitted to you. Lastly, in this episode, another misconception I want to address is the issue of people believing that everybody needs supplements. It is wrong. Like the word means supplement, meaning you are supporting something that is deficient. If you are not deficient of a particular nutrient, you don't need supplement. The common group of people that need supplement are pregnant women that need to be supplemented with iron and folic acid because the demands in pregnancy becomes increased. In the same way, some elderly people, when they have reduced calcium level, maybe they are prone to having fall and fracture, they can also be supplemented with calcium. And there's another places where some microminerals are less and deficient in diet. Otherwise, everybody does not need vitamin supplementation if it is not deficient. Hope to see you in the next episode of my broadcast. Thank you.